हेलो व्यूअर्स, वेलकम टू यूरोन यूरोलॉजिस्ट ऑन एयर। सो आज एक बार फिर से हमारे बीच एक बहुत ही एमिनेंट डॉक्टर आ चुके हैं, बहुत ही एमिनेंट न्यूरोलॉजिस्ट आ चुके हैं और चलिए इनसे कुछ बातें करेंगे हम। और हमारा जो टॉपिक होने जा रहा है दैट इज गोइंग टू बी बीपीएच। सो बीपीएच इज अ वेरी कॉमन प्रॉब्लम एंड द अवेयरनेस हैज़ बीन the people are so much aware about this problem and it has been diagnosed at an early age. So my first question is related to this only, but before starting anything I'd like to request you to please introduce yourself to the viewers.
Hi, I am Dr. H.K. Nagaraj, urology professor and head of Department of Urology at Saptagiri Medical College, Bangalore.
Okay sir, so my first question is related to BPH. What lifestyle modifications are important to avoid such kind of case between the age of 40 to 50?
Yeah. It's very important. You know, good exercise is very important, so that prevents people getting up several times in the night. And then after 6 o'clock, avoid the beverages like coffee, tea, and even alcohol. Restrict or avoid it, totally avoid it, so that you will have a good night's sleep. So the other thing is, some people have got the habit of in the middle of the night they get up and they drink a lot of water and then sleep again. So some yoga teacher has told that taking a lot of water is good for health.
Yeah.
So these are all the things it is should be stopped. And if the patient is diabetic, keep the diabetes well under control. Otherwise, that will also produce frequent urination. They have to get up several times in the night and pass urine.
Sir, my next question is related to this only. There are various cases where surgical intervention becomes very important. It becomes extremely important. But in what conditions surgical intervention becomes important? And the second thing, how it can be avoided?
So one thing is, of late you know that we very rarely we do surgeries. Majority of the time we try medical line-up management. And suppose some patients doesn't tolerate this medical line-up management. They get giddiness. So and some people have fallen in the bathrooms when they get up to pass urine. So this type of situations, unfortunately, we advise them to go for surgery. Second thing is, if they are getting the recurrent urinary tract infections, which are not able to control with medications, then and if there is enlargement of the prostate, there is lot of residual urine in the bladder, we ask them to go for surgery. Third one is, if there repeated bleeding per urethra, so which we cannot manage with the medical line of management, we advise them to go for surgery.
Hematuria.
Yes, hematuria.
Yeah.
Fourth condition is developing bladder stones. If the patient has developed bladder stones, so we can't give medical line of management, we advise them to go for surgery. Fifth thing is, suppose the patient is going for repeated urinary tract obstruction, retention of urine, acute retention of urine. We put a catheter, 48 hours, we give the medications, remove the catheter, after 10 days once again they come back with retention of urine. These are the conditions, limited conditions where we advise the patient to go for surgical management.
Okay sir, so my next question will be related to overactive bladder. So many of the patients, they have this problem, overactive bladder, and they cannot be able to control their urge to pass urine, and sometimes the wet episode is there. So my next question is related to that only, that what role does behavioral therapy play in the treatment of overactive bladder? Can you share any success that you had by incorporating behavioral therapy in a treatment regime?
Yes, many patients will be very tense. They may be busy in the offices, or they may be taking a lot of coffee, tea in the offices. So they have to avoid those things. And then it's nice if they may relax little bit, practice meditation or yoga, this type of people, and restrict the fluids. So to a little extent, we will be able to help them in these overactive bladders.
Okay, thank you so much sir. It was very wonderful having you. Thank you.
Thank you very much.
Have a nice day sir.